This is Campson, the creator of SCA Thrive, and this is a group that I created to give information you probably wouldn't get anywhere else. Who better to get information from than someone who is fighting the same battle as you are with sickle cell anemia? So this article is about Paula Tanabe, and she's an associate professor at the Duke University School of Nursing. And she notices the difficulty that patients have when they arrive at the emergency room and how difficult it is to get the treatment that we need. She has committed herself to having a mission to change that. Yes, you heard me right. Someone finally outside of us feels that there is something wrong and that something must be done. And so, y'all, this is the silver lining that many of us have been praying and hoping for. Of course, sickle cell is a genetic disease. Most of you all know this. I'm sure if you're watching this, it's because you're affected by this disease in some shape, form, or fashion. And so you pretty much know these things. But one thing she said that stood out for me was the common complications which often bring death by the mid-40s. This includes strokes, anemia, severe infections, damage to blood vessels, which they hardly ever acknowledge. I'm dealing with that right now. Kidneys, the eyes, and other organs. Treatment can also be complicated because many patients are unable to work, and that can lead to a lack of health insurance. This is a huge issue, people. One thing I want you to pay attention to, because people try to make it seem as if because we're living longer, everything is great and fine, and we've made leaps and strides, but that's not true, okay? A lot of us are dying by the age of 40, and I'm sure you all can relate to this. I have been personally impacted by this with people with sickle cell anemia who were in their prime, doing great things, making great strides, and died. This just has to be stopped. She says acute and unpredictable pain, severe enough to require large doses of narcotics, is a well-documented feature of sickle cell disease, but Tanabe has found that too often patients in sickle cell agony are not handled properly by doctors and nurses in the emergency department because they erroneously think the patients may be running scams, seeking drugs. Now, this is not coming from one of us. This is coming from one of them, one of the medical professionals that we have to deal with to get help. And you all, this is just so good for this lady to have committed herself to doing this. I'm going to try to follow her. It would be great if maybe I can get in touch with her and get some details as to what's happening. But she's basically saying that the people she worked with, the other healthcare personnel, they usually widely believe the knowledge, that knowledge is a sign of addiction. And so if you know what medication works and doesn't work, they think that that's a sign of addiction. We know that, but it's great to see this. They know that, and they're admitting to it now. Patients with sickle cell anemia, we average of 30 minutes longer for pain medication, okay, than people with other extremely painful conditions, such as kidney disease. This is based on Tanabe's research. Now, we know this. We have watched the Caucasian come in with a stomach ache and go back and get 2 milligrams of Dilaudid within 30 minutes of being back there. No blood work, no tests have been ran or anything, just off of his word. I have seen this happen hundreds of times. It's heartbreaking. It's heartbreaking to know that racism has affected the medical industry, but no one is talking about it. No one is dealing with it. Everybody talks about how unfair it is for LGBT community people to be treated certain ways, but no one is talking about the racism that has impacted the medical community. And so she goes on to say that when we were children, everybody felt bad for us. And whenever we had pain, it wasn't an issue. They gave us whatever we needed to feel better. But once an African American becomes 20 years old and starts asking for high doses of opiate narcotics, that becomes another sign of addiction. This is the reason why many of us do not go to the emergency room. This is why many of us will suffer or go to the day clinic every day of the week if we have to get better. And that may also become a sign of addiction. I do believe healthcare personnel think that we're addicted if they see us that often in the day center. But again, this is a system, and this is just what it is, and it's great for someone who doesn't look like us, right, to acknowledge this and do this article and admit to these things. And she talks about the rates of addiction. And she says there is no data to support that sickle cell patients have any more likelihood of being addicted than anybody else. People. Now, if you look at the statistics, healthcare personnel actually have higher statistics in rates of addiction than sickle cell. And the last time I checked, it was 4% or less. That is a very small percentage, people. Okay. People with kidney stone pain and with sickle cell disease, they're talking about comparing how we're treated once we get there. And she says a lot of white people get kidney stones and that pain is horrible. And even though sickle cell patients had higher pain scores and were triaged appropriately higher, they still waited longer than the Caucasian who was having some kidney stones. This is the issue, people. If they know how severe this disease is, why is this happening? Well, it's happening because of prejudice and racism, and because they can do it. They have the power to do it. In order to be racist, you have to have power behind your prejudice. And people, most melanated people, we don't have that power. And so how we feel about this has not impacted the way we are treated. But this indeed may help us. She talks about the barriers, that you just can't get away from. And she says, clearly, we can't pretend that racism doesn't play some part in this. If this were a white disease, people still wouldn't be dying in their 40s. That's the bottom line. Sickle cell was discovered 102 years ago, and there is only one drug, hydroxyurea, and blood transfusions to treat it. Are you all paying attention? This is like everything we've been feeling, everything we cry to each other about, everything we complain to each other about when we have a bad experience. She's now admitting this, right? So this is great. This is great. And I hope that Miss Tanabe continues in this mission. And I think we should give some prayer, her way so that she can succeed at this, because it's needed, people. This is Campson with SCA Thrive, and share this video. If you have someone in the family who's a nurse or a physician or just anything, any type of personnel or working in the medical field, going to school for nursing, this would be great to share this with them. Because if we can catch them as they're coming out of the school, maybe we can catch them before the stereotypes set in with them. And maybe we can have other people like Miss Tanabe to actually fight for us. Love, light, strength, continue fighting. We will thrive. Though we have sickle cell anemia, we will thrive.